Hey,
Greetings,
how's it
everyone.
going?
My name is Sharon Moreno. I'm a family nurse practitioner, and this is my super awesome co-host, Ray Martinez. Hi, Ray.
Hey, how's it going? Well, welcome to Let's Talk Health with Ray and Sharon. Tonight, guys, we're going to dive into the topic that affects millions of people around the world, hair loss. Oh, it's got another name, but I'll let Sharon give you that name. Whether you're dealing with thinning hair, bald spots, suddenly, hairs falling, shedding off, it's an issue that can be frustrating, emotional, and sometimes even scary. But hair loss isn't just about appearance. It can also be a sign of hormonal imbalances, stress, poor nutrition, other conditions, and even underlying medical issues, which I go, wow, hair loss, medical issues? Well, apparently it is. So we're going to open up with for the conversation, guys. Send us the questions and all of that. What causes hair loss? What are the solutions? And how does your hair reflect your overall health? Which is a question that, wow, just went by. So we're here to give you the facts, share some stories, and often offer some hope. Let's talk health. Let's talk solutions. Take it away, Sharon.
Absolutely. So we're going to start with our legal disclaimer, like we always do. During this time, if there are particular topics that you're interested in me presenting, please put those in the comment section. I've already had a variety of recommendations given to me, and everything that's been recommended thus far has been presented.
Mm-hmm.
So I'd like to know what you're interested in and um, and be able to present that medical topic. I do have a comment here, and it's for
Mm-hmm.
Alma, and she says, "Hi Sharon, hi Alma, how are you doing? I got your recommendation for the uric acid. I haven't forgotten about you. So I have you in mind.
Excellent, excellent, excellent. Hey, Alma, how's it going? It was a good question. She had a really good question. It's serious. I'm sure it's a serious issue. And, if our viewers have questions, we definitely want to get right on it and, either create a show or answer it. And we're definitely going to create that show for you. Juliana is up saying hi,
And
Sharon.
Juliana is here. I presented your topic last week. I was looking for you to thank you and tell you,
Yeah.
look, you presented your topic, but I think you were missing in action. But I'm glad to have you back this week. I'll put up my flyer here. Again, this is some general services I offer. I offer many that are not listed here. My cell phone number, if you want to communicate with me, please text. If you call, I don't answer phone calls. Please text me. 956-640-6963 is my cell phone number. Or you can contact me via Facebook Messenger under Sharon Moreno. Either of those work for me. If you're looking for, you have medical questions, um, you know, looking for consultations or whatever it is that you may be looking for medical wise, please feel free to reach out to me. I don't charge for questions um, or visits. I just charge for services that I provide. So I just want to reiterate that. That's my website, and we'll get right into the hair loss. So this is a pretty common topic that a lot of people go through. Male and females have this issue. So this is not particular to one sex, although it is more predominant in males, but females
Mm.
do go through this as well. So you know me, I love statistics. I always start our segment with some statistics because it gives us information on how important or significant a particular illness is. So in the particular case of the hair loss, approximately 85% of men and 33% of women will experience hair loss at some point in their lives. So 85% of men, that's a lot. Even the 33% for women
Yeah.
is significant. Roughly 25% of men start losing their hair before the age of 21. Go figure. Before,
21. Wow. Tan pollitos.
yes, yes,
Wow.
yes. By age 50, about 50% of men and 25% of women will have significant hair loss. So
Mm.
we get men to start losing, 25% of men to start losing at the age of 21. And by the age of 50, both men and women will have a significant hair loss.
Wow.
So again, that gives you an idea of how important this particular topic is.
Yeah,
Uh,
yeah. Well, I mean, you can understand 50, that kind of deal, even 45, but 21, man, that's outrageous.
People, 21 is, at when we start to be more mature, and I mean not mature as an elderly, but more mature in age. This is when we get to do a lot of things, vote, smoke, a whole bunch of stuff. And
Yeah, yeah.
so it is significant because it also marks the start of many changes in your body. Although we feel like 21 is an age where we're just kind of getting started, technically we start dying the day we're born. If you look at things that way, you'll understand the age of 21, why things are
Hmm.
happening at that particular age. So
Or
it's important that
sometimes,
we,
yeah, sometimes if you started partying early, by the time you're 21, you're already, okay, I had enough. Let me relax.
yeah, by that age, I'm seeing people with hair loss and needing
Mm.
Viagra. So time really
Are
does
you
pass by
serious?
pretty quick.
No way.
Yep,
Wow.
absolutely, yes. And I have
Man.
another comment here. Norma says, Bonjour, Mr. Ray and me.
Wee.
Hi, Norma.
Mademoiselle. How's it going, Norma? You're doing awesome.
So let's talk a little bit about, give some general information regarding
Hmm.
hair loss. So it can affect either just your scalp or the entire body, and it can also be temporary and it can be permanent. When
Wow.
we're talking about hair loss, obviously the biggest issue is on the scalp because this is where people see, other people see the issue, but this isn't, we're not just referring to hair loss on the scalp. It can be wherever there's hair on the body. And again, it can be temporary or permanent depending on the root cause of the issue. It can come suddenly or it can come gradually. So it can happen all of a sudden or it can happen over time. People typically lose 50 to 100 hairs daily, but this isn't noticeable because new hair is growing at the same time. 50 to 100 hairs is
Wow.
quite a bit of hair.
Yeah. Check your
You try
sink.
to yank
Check your
If
bathtub.
you try to yank out 50 or 100 hairs from your head and they're not being replaced, especially daily, what would that situation look like?
Mhm.
Pretty significant. And hair loss occurs when new hair doesn't replace the 50 or 100 hairs that fall out daily, which is what we're going to talk about today. Many people lose up to half of their hair before they start noticing the thinning. So, some
Wow.
people, again, since we have so many strands of hair, most
Hmm.
people don't realize that there's an actual issue until they've lost about half of the hair on their scalp. So
Yeah.
I thought that was quite interesting.
I guess the way
Each
you
follicle,
comb it or brush it also,
it
hides
can
certain
be, yes,
certain areas as well.
yes,
Uh,
yes. It can also absolutely be related to how you brush your hair. And we'll be talking about that later on today.
mhm.
Each hair follicle has a lifespan about 4 years, during which
Wow.
it grows about half an inch per month.
Hmm.
Half an inch per
Interesting.
month.
Interesting.
So that's a piece of information there that we need to consider when hair is regrowing, when medications and treatments are being rendered. We have to think about one, the lifespan of the hair, and two, how long it takes for the hair to grow,
Hmm.
because it gives you an idea whether certain treatments are working or not. So half an inch per month.
Wow. Amazing.
Yeah. So let's look at some symptoms of hair loss. What do we think about when we say the word or the words hair loss? Gradual thinning on top of the head. This is the
Hmm.
most common type of hair loss affecting people as they age. So on the surface of the scalp is what this is referring to. This is a gradual. Remember, we talked about some hair loss that could be fast, happens all of
Hmm.
a sudden. This particular one is gradual.
Wow.
We could have circular or patchy bald spots, where some people lose hair in circular or patchy bald spots on the scalp, beard, or eyebrows. The skin may become itchy or painful right before the hair falls out. So now we have some other issues. We have an itchy or painful scalp that may have some lesions. And this particular hair loss now isn't on the top of the head. We're talking about random places. We're talking about even on the beard, on the and on the eyebrows. So this is pretty significant, and I have a bunch of pictures of these particular patterns so
Mm-hmm.
that you can visualize what they
Yeah, yeah.
potentially look like. It's quite interesting. You know, when I look at hair loss, I look at again what symptoms are they having with the hair loss, if any, and what is the pattern of the hair loss, and again, what is the sex of the person.
Yeah.
So Alma has a question, and she
Yeah, she
says, "So
does.
like me, that I'm 60, 60, 10. Oh,
Mm-hmm.
I think she means then. Then what can I take or use for hair growth?" So we're going to talk about a variety of things. It
Yeah.
depends on the root cause. So if it's something like this, circular or patchy areas with itchy scalp, then we're going to look the treatment in that area. If it's gradual thinning, I treat hair loss quite significantly, and I tend to use vitamin B12 injections. That seems to work really well. I've gotten great results with it, as that's one of the vitamins that we that's not well absorbed in the skin. So we're going to talk a little bit more about vitamin B12
Mm.
injections here in a tad as soon as we
Yeah.
get to the treatments, because this is really important. It's we want to try to prevent it and get ahead of it if we absolutely can.
Yeah, yeah. Definitely.
So let's continue with symptoms. We have sudden loosening of hair, where a physical emotional shock can cause hair to loosen. Handfuls of hair may come out when combing or washing your hair, or with gentle tugging. So now this is an all of a sudden issue where now you're losing hair randomly and all of a sudden, and it may come out in chunks. And this one's talking about related to emotional shock. So
Yeah.
again, mental health, we talked about it. We had a mental health presentation earlier,
Mm-hmm.
some time ago, and we talked about how it can significantly affect things. Well, guess what? It can affect your hair as well. So that's
And this
important
also
here.
includes stress, right? As well.
Yes, yes, absolutely. Stress. It may be a death in a family. So it's some sort of emotional trauma and high levels of stress. Yes, absolutely.
Because in this picture we see hair all over his
Yes,
head, but it's
yes.
real thin, and it's not like it's a bald spot. I don't. Would you consider that a bald spot or just lack of
No,
hair?
this is like a hair period. So this looks like somebody who maybe's gone through chemotherapy and
Yeah, yeah,
is growing their hair back. That's what it looks like to me.
yeah,
Some sort of medical treatment where they've
yeah.
lost their hair. And we're going to talk about chemotherapy and things of
Yes,
that
yes,
nature as well. Again, there's a variety of reasons why we can lose some hair or all hair.
yeah, yeah,
And then now we're talking about full body hair loss. So again,
wow,
we're not just necessarily concerned about the scalp, although people tend to run to see their medical provider when it's a scalp issue,
yeah,
because
yeah,
it's so noticeable. And then it gives us our identity.
yeah, yeah,
Hair,
yeah, yeah. Well, that's
yeah,
why they sell
that's why.
wigs. That's why they sell
Yes,
wigs
they
and
do.
toupees, and
We're going to talk
so
about
yeah.
wigs too. Yes, yes, absolutely.
Wow,
It's a
pretty
sense
cool.
of identity, and
Yeah, yeah,
that's why some particular religions cover that,
yeah, yeah.
because it kind of removes people's sense of identity and the beauty, if you will. A lot of times people are considered either beautiful or not so beautiful aesthetically based on
Hmm.
what their hair looks like, or
Yeah.
and for some people who have a lot of hair thinning or bald spots, then that's not necessarily very exciting.
Yeah, we can't all
I
be
have
Sinead O'Connor and be beautiful like that when we don't have
That's
hair,
right.
you know?
Yes, yes. See, and it has to do with stereotypes. That's
Yeah.
sort of the issue,
Hmm.
is that stereotypically women tend to have longer hair or fuller heads of hair, whereas, men, it's a little bit easier for them to rock that
Yeah,
baldness. They can
yeah,
shave their head, and, it seems to be a bit more
right, yeah, it's true.
socially accepted. But
Hmm.
I tend to not like following social norms and things of that nature.
Right, right.
I don't believe that men should have only short hair. If they choose to have long hair, more
Hey,
power to them.
yeah. Well,
Women, if they sure, women, if they choose to have short hair or they want to shave their head, more power to
look,
them.
you got short hair,
I
so it looks
do,
great.
I
It
do,
looks great.
but my hairstyle, I is typically not something a gentleman would wear. Um, it would have to be something like yours in order for people to sort of frown upon. Again, I don't particularly care. I I'm very big on self-expression, so I think
Yeah,
people
yeah, yeah.
present
No.
themselves as they feel comfortable. Um, so here's Alma clarifying her age. She says 70, but sounds better as 60-10. So 70. All right, super awesome.
No,
It
you're
always
you're
makes me
50 and
excited.
20. 50 and 20.
There you go. And she has another question too. She's asking, does thyroid, can thyroid problems cause loss of hair? Absolutely. Yes, yes, yes. That's actually a big cause of thyroid, of hair loss. Thyroid issues is absolutely one of those. Once the medication was the thyroid levels are brought more to norm, then the hair loss will either significantly be reduced or stop completely. So yes,
Also,
absolutely.
like bad nutrition, like lack of iron,
Yes,
protein, zinc, vitamin
yes,
D. The
yes,
that's
yes,
very
yes,
important because we were talking a
yes,
little bit about that in another show, where nutrition and that kind of deal. But yeah,
absolutely. Yes. There's a saying that says we are what we eat, and we really are. If you don't put maintenance into your body, it's like a vehicle. If you don't put maintenance into your body and or your vehicle, then the outcomes aren't going to be great. You're going to be feeling tired, sluggish, sick, uh, hair falling out, poor vision, always hungry and thirsty. And it's the same thing with a car. Your check engine lights
yeah,
start
yeah,
coming on, and your hair loss is a check engine light. We just have to
yeah,
know how to interpret these human check engine lights.
yeah, yeah, yeah. And of course, there's as you take a shower, well, there's always the dandruff. So you buy the dandruff shampoos, that
Yes,
help you with that. So it's like,
sure, sure, sure. Absolutely. Yes. Dandruff can ultimately cause hair loss. So that's significant too. That's something that we address. I've addressed that many times. So we look at full body hair loss. I know we've been
mm,
talking a little bit more about scalp, but if we talk about full body hair loss, some conditions and medical treatments, again, such as chemotherapy for your cancer, can result in the hair loss all over your body. And this
mm.
usually grows back. What I have seen is people grow the hair back, but it may not be exactly the same. Like maybe they had straight hair and all of a sudden it grows back curly.
Yeah.
That I have seen.
Well, you know what? When I was in grade school, or actually in the sixth grade, a friend of mine had straight hair over the summer. He shaved his head, and then he came back with curly hair, and it was
Sure.
weird. And yeah, it's good that you say that, because if you want curly hair and you have straight hair, shave your head, and
Shave
then
your
you
head
have curly hair.
and you have a percentage that this may occur. It
Yeah,
may be that you're now bald and still come back with the same consistency of hair.
yeah,
So
yeah. So
gotta warn you that it may
that's
not
why
happen.
I'm not the expert.
Hey, but if you have straight hair and you really want curly hair,
Hey,
it's worth a try.
right, right.
Um, we're looking at also patches of scaling that spread over the scalp. This is a
Yeah.
sign of ringworm and may be accompanied by other
Wow.
symptoms such as broken hair, redness, swelling, and oozing. So again, we need to look at symptoms associated with the either hair thinning or hair loss. And so I always ask, is it just hair loss? When are you noticing more hair falling? Or is it during shower time? Are you having any itching to your scalp? And these sort of things, because all of this provides clues as well as the scalp exam as to what potentially can be the root cause of the hair loss.
Yeah. Also,
Uh,
I don't know. I'm sure you're talking about this. Extensive styling. Because that causes damage,
yes,
because the heat, the chemicals.
yes,
The
yes,
tight hairstyles over. I mean, it just weakens the hair. I'm assuming, or if you buy cheap chemicals for your hair,
sure.
you know.
Sure. So yes, the hairstyling, it has to do with tension. If you put like tight cornrows or pigtails or chongos or whatever, if that they're too tight, then you're causing constant friction or tugging on the hair shaft, and that can cause it to become loose and ultimately fall out. So we're going to talk about that as
Wow.
well because that's extremely important. as well as products that you mentioned. When people do a lot of perms, a lot of
Hmm.
dyes, all of these are chemicals and are considered foreign to the scalp and the hair shaft and the hair strand itself. And so it can cause significant changes to the body of your hair. I have
Wow.
a couple
Norma's
of
got some
comments here.
comments here.
Yeah, so she says female and male hormone imbalance may cause hair loss as well. Absolutely. So when
Yes.
we have changes in estrogen, progesterone, testosterone, etc., we absolutely can see changes to your scalp. And when I say scalp, it's hair in general, but again, the biggest it seems like people tend to run to their healthcare provider when we're referring to the scalp, but this is all over the body.
Yeah, yeah. And she
She
had
also
another
says,
comment. Yeah.
yeah, she says, don't comb your hair right after you wash it. Absolutely. Again, we're
Really?
going to be talking about that as well. But when your hair is wet, it's more sensitive, it's more delicate.
You
And
can
so at
pull it
that
off.
time, we definitely don't want to be pulling on. And if it's already sensitive enough, uh, when it's not wet, it makes it even more sensitive when
Hmm.
this is wet and much easier for your hair to come out. So that's why I ask patients, have you noticed, is it falling out when you're in the shower? Do you notice that your drain's kind of collecting a bunch of hair, or is it when you brush it? Well, or is it randomly? Is it like shedding on your clothes? And so again, all of these provide a lot of insight on what the potential problem is.
Yeah,
So
yeah,
we'll
yeah.
continue here. Well, let's talk a
Makes
little bit
sense.
about causes. So this is kind of some of the things that Norma has mentioned, that Alma has mentioned as well, that we're going to go over here. So family history. Again, this happens with age, wear and tear. This is usually gradual and in predictable patterns. A receding hairline and bald spots in men,
Yeah.
and thinning hair along the crown of the scalp of women. So when we tend to, I tend to see this again in people who are postmenopausal, and in men it varies so much. Again, we talked about hair thinning at the age of 21, where they've lost hair. Then I have seen quite young men with thinning and or receding hairlines, and a lot of times it has to do with genetics. Genetics
Yeah.
plays an important role. You can look at your parents or grandparents and see what their hair looks like. And that, again, likely is going to be a reflection of what you likely will end up going through.
Yeah, yeah.
This is one of the things that Norma mentioned. She talked about hormonal changes and particular medical conditions. So we have hormonal changes due to a variety of things. It could be due to pregnancy, it could be childbirth, it could be menopause, it could be ringworms, it could be vitamin B12 deficiency or hair pulling disorders. There are certain people who suffer from anxiety, and they have a certain
Mm,
condition that when they're
yeah.
anxious, they start plucking out their hairs from their scalp or from their eyebrows, and so you'll see them with, and this is significant, that this isn't just one or two strands. This is a whole bunch of strands, to where likely they end up having to shave their head because they pull
Mm.
out so much hair. So this is a significant mental health related illness.
Yeah. Also,
We talk,
what's it called? The immune system being weak. Also, right?
sure. Well, the vitamin B12 helps stimulate the immune system, as well as vitamin C. And so we have to look at, again, at nutrition. If if their immune system is low, why is that? Is it because they have a particular illness that's causing it, like diabetes, rheumatoid arthritis, lupus, those kind of things? Or is it related to poor nutrition, where their body isn't getting the proper tools needed to boost the immune system? So again,
Wow.
we want to ask about nutrition. That's really important. We talked a little bit about radiation therapy to the head.
Mm.
The hair may not grow back the same as before. We mentioned that before. So we may have a change in the consistency of your hair. And so that's something that we have to be aware of as a potential risk when we've lost our hair. We want to continue to talk about more reasons why your hair can fall out. We talked about stressful events. Some people
Hmm.
express a general thinning of the hair several months after a physical or emotional shock. This is temporary. So once we start to regain our sense of self and being and homeostasis, then likely the hair shedding will stop. And so your head will start to become fuller because, again, remember the issue with hair loss and or definition of hair loss is losing the 50 to 100 strands of hair and it not being replaced. And so we start to have the hair that's falling out being replaced, then that's going to create a fuller scalp of hair. That this is what you mentioned, Ray and Norma as well, hairstyles and treatments. Excessive hairstyling or hairstyles that pull your hair tight, such as pigtails, cornrows, hot oil, um,
Hmm.
hair treatments, hair dye, and perms. So these are some issues that again can cause changes to your scalp, and we want to investigate all of these things. People come in, are they using a lot of different products on their hair? Are
Yeah.
they using hairstyles that are, a bit tight and constricted to the scalp?
Yeah. Yeah.
Are they straightening their hair a whole bunch and adding a lot of heat? All of that stuff, affects our hair distribution. And we have Diola here. She says, "Hi, Sharon and Ray." Hi, Diola. How are you? Thank
How's it
you for
going?
joining us today. So we're going to continue to talk about hair loss. It's a pretty common side effect with a variety of very common medications. And so another area that we need to investigate when we're talking about hair loss is what medications are you taking and how long have you been on them?
Mm,
Um, Again, because remember, medications are great, but they all have side effects, and
yeah.
only the patient who takes them can assume the risk that's associated with it. So let's talk about these medications. We have things like retinoids, like the isotretinoin. We have antidepressants. This is a super common class of drug, and a lot of people take these medications. Drugs like Wellbutrin, uh, SSRI category, and examples is Zoloft. We have SNRIs like venlafaxine. These are all different categories of antidepressants that are commonly prescribed. I know I prescribe them a great amount because they work well.
Yeah.
Blood thinners like Coumadin, Eliquis, and Xarelto. So these would be patients that have had surgical procedures to their heart or abnormal rhythms of their heart, different stents for aneurysms and things of that nature. So these are pretty common classes. I don't see Coumadin as much these days because you have to do a lot of levels with these drugs and make sure that they're therapeutic. But the Eliquis and Xarelto, pretty common. A lot of people take these. We have anti-seizure medications like Lyrica and Keppra. Now, Lyrica is considered an anti-seizure medication, but we use it for a variety of reasons. We use it for neuropathic pains, um, uh, numbness, tingling, those sorts of issues. And Keppra we use for major depression, also seizure disorders as well. So we can use that for a variety of things. We have beta blockers. We use these are like propranolol, atenolol. We can use those for a variety of reasons as well, um, but mostly for their particular heart rhythms, arrhythmias, or fast heart rates. We have arthritis medication like methotrexate. Now, this arthritis medication, methotrexate, we use in rheumatoid arthritis, which we talked about last week. We talked about arthritis last week, and we talked about methotrexate. Gout medication, which is the topic that Alma was interested in, like allopurinol. We use allopurinol to help bring down uric acid levels, and this can cause some hair loss as well. And other drugs like Parkinson's disease, where they use
Mm,
carbidopa, levodopa, and finally, the very common weight loss drug Ozempic. So you may see people losing weight, but now all of a sudden having issues with their hair that we need to address. So very often, what I end up doing is treating people with Ozempic and vitamin B12 at the same time for more than one reason. One, because it helps with the hair loss, and two, it can help with the nausea and stomach-related symptoms associated with Ozempic, because Ozempic tends to cause a lot of nausea and diarrhea and or
mhm, mhm.
constipation. mostly constipation though, and the vitamin B12 assists with that. I
Yeah, yeah.
have some comments here. Norma says, my sister and I had significant hair loss for years. We started B12 injections for energy, but to our surprise, by the second injection, hair loss has stopped completely. We are now noticing hair growth. So
Yeah.
there's a testimony from someone there telling you how how vitamin B12
Hmm.
can be therapeutic for this particular situation. So this is not uncommon. I am seeing this a whole bunch, and so that's why I treat a significant amount of patients
Yeah.
with B12, because not only does it help with your hair, but it helps with so many other things: mood swings, forgetfulness, things like depression, simple brain fog, forgetfulness. Where did I leave my car? Where did I park my keys?
Yeah,
So
yeah.
quite a few things.
Yeah, and as we get
And then
older,
we
we're
have
getting closer to that. Yeah.
absolutely, yes, it does. It does happen with age. And so again, Ray is reminding us all to please follow and share Golders Health Solutions. Ask your health related questions, please, during our segment. That's what we're here for. We want to discuss um, whatever questions, comments are definitely welcome. I love comments and questions. And please feel free to post whatever topics of interest you would like me to talk about in the near future.
Yeah.
So, we're going to talk about risk factors. What could possibly lead you
Mm.
to hair loss? We look at family history. Again, genetics plays a big part in what we ultimately age and look like. Age, significant weight loss that's rapid. So, we have somebody who loses weight rapidly.
Wow.
The reason it's associated with rapid weight loss is because there's only a few the most common way you lose weight rapidly is through bariatric surgery. And again, this affects your intestine and absorption of multiple vitamins to include vitamin B12. So I
Mm.
see a significant amount of bariatric patients who had weight loss surgery, and they must be on B12 injections, not pills. When we're talking about vitamin B12, we're not talking about pills. We are strictly talking about injections. The pills are poorly absorbed and will not get you those results. Certain
Wow.
medical conditions like diabetes and lupus, again, these are autoimmune issues that can create a deficiency in hair. Stress, we
Hmm.
talked
Hmm.
about as well. So we need to manage stress.
Yeah, yeah.
We can manage it by affecting coping mechanisms or by medications. Poor nutrition, where again, vitamin B12 is lacking. So, do you notice a big common denominator is vitamin B12
Yeah.
injections? They are injections. And I have some comments here and questions. So Alma says, I got B12 drops for under the tongue. How often can I use it? So that if you're going to use something over the counter, the sublingual, which are these drops, is the best way to go. But it still does not give you the hair growth that you're looking for. So this is not going to help you. But if you're not able to purchase injections, then the drops are the way to go. So I would need to know the dosage that you're doing, and then we can talk about the amounts of drops and things like that that we can use because it varies on actually vitamin B12 is in uh, micrograms, so micrograms per milliliter per drop.
Mhm. So it doesn't really have the gas to keep going, whereas the B12 injection, it's premium.
Yes,
you go
yes,
100 miles an
yes,
hour with that one. It just takes care
yes.
of business.
The reason why I'm so passionate about the B12 injections is because this is one of those vitamins that is people are so many people are low, and it has to do the reason why pills and sublingual things aren't as effective is because it has to do with the absorption of the medication. The issue with the B12 is it's poorly absorbed in the intestine. And so we're swallowing pills and medication, then guess what? It's not being absorbed because the issue is the absorption. So we have to change the route of the drug in order to
Mm.
get the maximum and or benefit. And so we
Wow.
do those via injections. Now, Alma, if you're interested in B12, message me and I can get you set up with that. I do sell the vials of B12.
Cool.
So we have another comment here. Norma says, Mom started B12 injections for fatigue. She has had significant GI issues for many years. With only the very first injection, the belching, abdominal inflammation, etc., has resolved completely.
Wow.
Again, and when she says GI, she's talking about gastrointestinal. So this is like stomach and intestine related things. And
Mm.
she's voicing those as belching, uh, abdominal inflammation, which is like bloating,
Mm-hmm.
diarrhea, constipation, but it's usually constipation.
Yeah.
And she's saying that after her very first injection, these symptoms ceased. Again, that's
Wow.
why I very much so prescribe, or actually I should say give, vitamin B12 injections when I'm using Ozempic and Mounjaro and things of that nature, because these particular injections have a significant side effect where they're belching, bloating, having constipation, and the vitamin B12 helps to alleviate these particular symptoms.
Mm.
You know, the funny thing is many people say, well, you know what, I'm tired, let me do some B12 injection. And they're thinking that the only benefit they're going to get is increased energy. But the reality is B12 offers so many things. Again, Norma's mother had the benefit, you know, she's been suffering with stomach related issues for years. And she started the B12. Now she has energy and her tummy issues have resolved. That's
Mm.
significant for quality of life,
Yeah, yeah.
especially if you're, you know, you're bloated, you don't feel like eating. That means your intestines are not moving as they should. Either you have slow gastric emptying where you eat, and it takes a long time for the food to empty out of the stomach into the intestine, or your intestines aren't moving as they should, and so the movement of the intestines is known as peristalsis. That peristalsis movement is not moving as it should, and so the poop kind of just hangs out there in places where we don't want it to be.
Hmm.
And Norma has another comment. She says B12 injections may be more beneficial for many other ailments than we thought. I took sublingual and pill form B12 with no results of any type.
Wow, there it
So
is.
again, she talked about her hair, you know, the regeneration of her hair, and she's talking about taking sublingual, which is what you're referring to, Alma, under the tongue, and pill forms. And again, we have to think about the reason why B12 isn't we aren't getting benefits, and it has to do with the absorption into your intestine. And so we keep putting stuff in our intestine, and essentially what we're doing is kind of wasting our money. We're throwing pills down
Mm.
the
Wow.
sink. We don't want to do that. We don't
Yeah,
want to
yeah,
keep
makes
buying
sense.
pills.
It's not going where
We're
it
ma-
needs to go. It's not going where it needs
yes,
to
yes,
go. That's I think that's the key. It's not going where it
it
needs to
is.
go. Or
Yes,
maybe only a little bit of it goes where it needs to go and the rest is wasted, you know?
that's correct. That's correct.
Wow.
And it's not enough to be significant to cause, you know, like changes in your tummy or changes in your hair or changes in your energy. Really, if you notice, you know how you know this is going to the toilet? Start to take vitamin B12 pills and look at your urine. It's a bright yellow. And that's because all the urine is being excreted, all the B12 is being excreted. When you take vitamin B12 injections, you don't have this bright yellow urine, and it's because your body is absorbing it and metabolizing it. It's going to
Wow.
where it needs to be, like Ray said.
Yeah,
You know,
yeah.
with B12,
I mean,
what we don't use, we pee out, and so you'll see it in the toilets if you take pills. Whereas the B12 injections, you won't see that. So we're talking a lot about B12 today, guys. If that is something that you're interested in, I want you to tell me about this. Now, today, since I am so passionate about B12 and it's significant to our topic today, for any of my listeners who have not tried a B12 injection with me and would like to try a B12 injection with me, again, message me through my Facebook, through Messenger, or text me to my cell phone. tell me who you are, and tell me that you'd like to try my B12, and for what reason are you interested in trying the B12? And I'm happy to offer you a free B12 injection. We can meet and we can get your B12. No mailing of B12. You must come and see me, okay? Or have someone take it to you. So I do have another comment here from Norma. She says, no yellow pea with vitamin B12 injections here. So there's that testimony there, it's not being excreted. Alma says, okay, that's interesting. I do have some injections, but it's once a month. How often should I take the injections for me to see results? So that is a great question. And when I sell the B12, I give you a schedule. It's based on a variety of things. So I'm going to ask you what symptoms you're having. Are you having fatigue, like feeling tired? Are you having numbness and tingling? Are you having pain? Are you having mood swings? Are you having vision problems? Are you having hair loss? Are you having brain fog? Where did I park my car? Where did I leave my keys? Then you give me the responses to those, telling me which symptoms you have. And then I want to know if it's mild, moderate, or severe. Depending on what the response is, then I will place you on a schedule based on your responses. So it varies. It just depends on what the symptoms are and how bad they are. But I will say for hair loss, let's talk about hair loss so that I can give you some general information. What I tell my patients is they're to do weekly injections at 1,000 micrograms. 1,000 micrograms daily for 7 days and then weekly. That's usually the schedule I place my patients on. Again, based on solely hair loss, solely it being moderate to severe and something that you're concerned about, that's what I recommend. Now, I'm not talking about Bayodecta, and I'm not insinuating that you're using that, but I just need to be clear that Bayodecta is not vitamin B12, the vitamin B12 that we need. That has multiple vitamins and they have very small dosages. The vitamin B12 that I'm referring to is a prescription grade vitamin B12 at the appropriate dosage of 1,000 micrograms. Okay, that's what I'm talking about.
It's the real deal.
Yes, yes, yes. And again, if you know someone who needs or having a difficult time finding it, then definitely reach out to me. I can help you with that.
Wow.
So let's continue with prevention with vitamin B12. So what can we do to help prevent some of this hair loss? So these are some of the things that we spoke about earlier. Be gentle with your hair. Our hair is delicate, even though it looks tough, it
Yeah.
is extremely delicate. Use a detangler and avoid tugging when brushing and combing, especially wet hair when it's more fragile and frail. Avoid harsh treatments such as hot rollers, curling irons, hot oil treatments, perms, rubber bands, and braids. If you're going to use something to collect your hair, then I recommend something that's coated and not the rubber alone, something that has some cloth or some scrunchie so that it's not tight constricting. And when you remove the rubber band, it doesn't pull out half of your hair because that's not what we want. Ask your provider to reconcile medications and review the ones with this particular side effect. So out of those medications, I listed the more common ones. If you see that you're taking these particular medications and it's causing a significant issue with your hair, you have the right to tell your medical provider, hey, I'm having a significant issue with my hair. Is there an alternative medication that I can take with similar benefits, but less risk related to my hair loss? Protect your hair from sunlight and other sources of UV rays. That could be a cap, a hat of some sort, umbrellas. Stop smoking. I don't know how many things smoking affects, but it affects a significant amount of things.
Yeah.
So if I'm going to ask you to stop smoking so that you don't lose your hair, then you might as well enjoy the benefits of so many other things, lung issues, heart issues, and you name it, the list keeps going.
Mm-hmm.
And so Alma has another comment here. She says, I have RA, that's rheumatoid arthritis, and this is an autoimmune disease.
Hmm.
Remember, we talked about this
Last
last
week.
week. We talked about, yes, about rheumatoid arthritis, where you saw the significant deformities in these joints of the
Hmm.
hand and the MCP joints of the hand. That's a big symptom of rheumatoid arthritis. This is an autoimmune disorder. And so she says it comes with chronic fatigue, hair loss, and other issues. Yes, because a lot of these medications that are being prescribed for rheumatoid arthritis have the side effect of hair loss, like methotrexate. It's one of those super common medications that's used for rheumatoid arthritis. And just
Hmm.
the condition itself, it's a really, really tough condition: pain, inflammation, deformity, so difficulty completing certain tasks, fine motor movements with your hands. Norma has a comment. She says, rinse hair with cool water after shampooing to close the hair follicles, which will prevent too much of hair loss while combing after shower. Absolutely. Yes, yes, yes. So heat absolutely does cause vasodilatation where the pores of the hair open, whereas cool water causes the opposite.
Wow.
It causes vasoconstriction. That is a great, great, great point, Norma. Thank you for mentioning that. I don't even think I mentioned that in my PowerPoint, so thank you. Yes,
Hmm.
makes me excited. Alma says, is cyanocobalamin 1,000 micrograms? Is not pure B12. That is the B12 that we're looking for. That is pure B12. This is good. So you can use this for injection. You could do the 1,000 micrograms daily for 7 days, and then weekly for the hair and boosting of energy. So
Wow.
that's good. That's what we're looking for. The cyanocobalamin is a uh, is a medical term for the B12. So yes, thank you for bringing that up. Thank you. So we'll continue here with prevention. Um, well, actually, more diagnosis at this time. So diagnosis, how do we diagnose hair loss? We look at blood tests. Certain blood tests can help uncover medical conditions, and vitamin B12 deficiency. Again, we keep hearing about vitamin B12. We talked about hormone imbalances. We talked about low thyroid issues, high thyroid issues, or thyroid issues, period. We talked about that. And blood work can help uncover those issues. Poll test. So we test where several dozen of hairs are pulled to see how many come out. I'll be honest, I've never done that. For the reason being that I would hate to grab several dozen of hair from somebody who has already compromised scalp and yank on the hair. I don't want to get punched. And so I have never done that, but that's something that could happen. I'm just not going to be the one to do that.
Hmm.
And scalp examination, you talked about dandruff, Ray, and this is a picture
Yeah.
of dandruff there.
Yeah. No.
Careful examination of the scalp for lesions. Do they have a rash in their scalp? Do they have flaking in their scalp? What's going on there? Do they have sores? What are the issues?
Wow.
And so scalp examination is extremely important in that situation. And then let me see. Alma says, but my doctor said I don't need it that often. How do I convince them otherwise? So this is a
Hmm.
tough issue here. Your doctor prescribes the medication likely based on lab results. And anytime we look at lab results, then many times it's hard for it to be covered. And that's why the vitamin B12 that I do is cash pay, because the insurance does not want to cover it. You're not going to get therapeutic levels or outcomes by looking at lab results for a variety of reasons. One, anytime you take vitamin B12 and you do vitamin B12 levels, you are going to come out with a false positive of very high. So you start B12, then they check levels. Oh, you're high, stop it. And so guess what? Now you have to stop it completely. When the reality is they shouldn't be testing B12 anymore. They should be testing MMA levels and the homocysteine levels to help evaluate whether B12 is truly at therapeutic levels
Hmm.
when you're already taking vitamin B12 levels. I mean, vitamin B12. Now, Alma, the issue is that each head is a world, and this is not necessarily a medical provider issue per se. It's more of an insurance issue. So the way vitamin B12 gets covered is through lab results. We cannot document a vitamin B12 deficiency unless we have reason to back that up, which means vitamin B12 becomes is low on labs. I've been doing healthcare for
Mm.
about 20 years, and you want to know how many times I've seen a B12, a low B12? Never on labs, but I did have one patient who was caught by someone else, and I was seeing her, and it was so severe that she stopped walking. She was no longer able to walk. She had
Wow.
severe numbness, tingling, weakness, and she literally had to relearn to walk again. But it was so severe that she continued to have difficulty walking even after B12 was replaced. So that's why this is significant. So the way you can get B12 outside of the doctor is by getting it by a medical provider who provides it cash pay, and I'm one of those.
Mm.
So yeah, it's kind of difficult with this issue with B12.
No, but it's good. It's good that they have resources that they can get with you so they can get
Yes,
the B12 injections and other advice and other services that you provide, because otherwise people are at a loss or at the mercy of the doctors and the clinics and whatever. But with you it's an immediate deal. I mean, it's a matter. I mean, what maybe they spent maybe 30 minutes to an hour, but they get satisfaction. Their
absolutely.
problem is taken care of. There's a solution. You
Yep,
put them on a program if they need to be on a program, or
yep.
like who was it that said that with one shot she felt 100% better, and it's like, wow.
Norma, yes,
Yeah,
Norma mentioned
no.
that. Yes,
So
yes. It's if you use it correctly, um, based on symptomatology, then you can have life altering changes. Look at Norma that said her mother had a GI related issue. She's burping and bloated and things of that nature, and just with a few treatments, after one treatment actually, she it ceased. And Alma says, I know I'm going to get out of the hair loss discussion, but your Theo was diagnosed with uric acid. What can he take
yes.
to reduce it? Right now, he's in pain. And so this is the issue with uric acid. For one, there's particular medications like colchicine that we give in the interim. I would definitely do ibuprofen. Uh, because that's going to reduce inflammation. If you were in my area, I would see him and give him steroid injections. That is really what's going to help. This is some devastating pain. But the issue
Hmm.
is it has to do with diet changes, low purine, like reduction in meats to eliminate meats, especially now while he's in the inflammatory process, reduce meats, cheeses, wines, alcohol. And this is, if you Google purine, Purine, this is the issue that's causing the uric acid in between the joints. Um, and so that's what we
Wow.
need to look at there. That needs to be reduced. But he can do steroids, but he's unfortunately going to have to get them from his primary care doctor unless you want me to prescribe them for you. Then I absolutely can. Send me a message and I can do it via telemedicine and get you what you need if he hasn't gotten what he needs. I see patients all over the state of Texas. And so as long as you're in Texas, I can do a telemedicine consult with you and get you the medications that you need. I am cash pay though, but my prices are extremely affordable for a prescription that I send in. One prescription is $35, two or $40. And this is give or take what you'd pay for
Yeah.
copays. So just something to consider.
That's the best way to go. You
Sure.
know.
Now
Yeah.
we're going to look at treatments for hair loss. Minoxidil. So this is Rogaine. This comes in liquid and foam forms. To be the most effective, we need to apply this to the scalp once a day for women and twice a day for men. Again, men have more significant hair loss. This helps to regrow the hair
Hmm.
or slow the rate of the hair loss.
Yeah.
It may take a few months to tell the treatment is working. Again, remember, we only grow about half an inch. And so that's Why? It takes a while for this to be determined if this is actually working or not. If it works, you'll need to use this product indefinitely. So you're confined to this the rest of your life, because if not, then the effects are reversed. It's kind of like B12. B12 isn't a short-term gig. It's not like, okay, let me do it for 2 weeks and that's it. It is for the rest of your life, because when you stop, your body doesn't produce B12. We're not absorbing it well. And so guess what? Now all of a sudden you're going to go back to the same symptoms you had initially.
Yeah.
Side effects of this include scalp irritation and unwanted hair growth on the edges and skin of the face and hands. So now all of a sudden you may become a werewolf with minoxidil. Finasteride is kind of the same situation, except this is a prescription for men only. Um, it again needs to be taken indefinitely, and side effects for them may include diminished sex drive, sexual dysfunction, as well as an increased risk of prostate cancer. So that's a tad significant there. We look at other treatments here. Again, we talked about B12 therapy, hair transplant surgeries, which are expensive, laser therapy is expensive, and of course, wigs and or shave your head completely if that's, something that you'd rather go with. Now, I love pictures because
Yeah.
pictures tell 1,000 words. So let's look at some examples of of hair loss that we could possibly see within people. So this is the male pattern baldness. We usually see a bald spot towards the mid centralized back of the scalp, and
This
then
is
we
the
have a
whole head,
receding
though. This
hair.
is the head, right? This is the whole head. Because I thought it was the top
Yes.
part was the head, and then this person had long hair.
No, no, no. This is the top part of scalp, so it's kind of
Yeah,
like
yeah,
bird's eye view.
yeah,
Yeah, and you can see the receding hairline.
yeah.
It starts kind of like at that widow's peak. It starts
Mm-hmm.
thinning in the middle, and they have that bald spot on the back. So this is a typical
Wow.
male pattern baldness. Usually, when men are complaining about hair loss, if I look at their scalp, this is what I'm going to see.
Mm.
Let's look at female pattern baldness. So
Oh
female
my
pattern
goodness.
baldness is not the same like male pattern baldness. So we don't as commonly see these widow peaks. That's usually not what we see in women. For women, we look at the very top of their scalp and we can see that thinning there. You see like significant amounts of the scalp here. And that's usually what we would see. If you're looking at bird's eye view, this is the top of the scalp.
Yeah.
Now, this is quite interesting. When we see circular, remember we talked about circular, scaly areas. This is referred to as alopecia areata. This can happen because of stress. This can happen because of autoimmune issues. This is
Mm-hmm.
quite significant, and this happens all of a sudden. But it stands out because look at these circles here. You can
Yeah.
see, it's not a pattern of baldness, it's
It,
patchy.
it's
And so
not
this is
pretty.
when I see this, it is not,
It's
no,
not
no, no, no.
attractive. It's like
I have seen
something's
multiple
wrong with you.
patients.
Something's wrong with you.
Yeah,
That kind of
yeah,
deal.
I've seen multiple patients with this, and yeah, it's
Wow.
quite devastating. This is traction alopecia. We talked about tight braids or tight cornrows. This particular person has braids, and look at the part in the middle and the
Hmm.
widow's peak. It's open because it's tight, and so hair are being affected.
So it's spreading. It's
Yes.
separating.
Yep.
That kind of deal.
Yep.
Wow.
Yep. Yep. And then we have another form of this is here is a female a scalp. This is kind of like where we look at the hairline, and you can see that it's receding there with thinning in that area.
And there's little
Normally,
spots in there.
those are sunspots. That is not from the hair thinning.
Oh, okay.
That's a different situation, which I treat that as well. But yeah, that's a different condition. It's a skin condition. And that is essentially it with the hair loss.
Awesome. Well, it's great show, and wow, a lot of good information. I mean, it's amazing. Every week that we've been doing shows, I'm being more appreciative of what you do and learning from you. And man, the community definitely needs to see this show because you're giving, I mean, free medical advice. Sometimes we don't get the answers. Just because we go to the doctors doesn't mean we get the answers unless you know how to talk to these doctors or these nurses. If you, I mean, I've gone in there before, whatever it is, and I'll answer their questions. But a lot of times I don't have questions because I don't think of them. But
Sure,
or I don't know, or maybe they'll answer my question, but or maybe I'll ask a question, but they don't answer it to my liking. It's
sure.
like I didn't get educated. I didn't get what I needed from them. They answered the question, but it's like I'm still puzzled as to hmm. And it
Sure.
kind of it kind of it makes me feel
Mhm.
frustrated. Like, was maybe I'll go to another doctor or something like that. And so it's good that you're doing this because hey, they won't go away from you without with questions or
That's correct.
puzzled about the visit, which I think is
That's right.
key. Which is key. Yeah, I mean, they're definitely great customer service in a sense. It's like uh, I don't know.
Yep, and you're right. And the thing is that, regarding your follow-up questions, you may think of questions when you leave, and all of my patients have my cell phone number. So they think of a question an hour, 2 hours, 2 days later. They can
Yeah,
always text me, and they have direct access to me. It's not leave a voice after the leave a voicemail after the tone, or call back a week or 2 weeks later and it's from not the medical provider, it's someone else. They always have access to me directly. I am
yeah,
my own business.
yeah.
And so that's extremely important as well.
Let me say hi, a shout out to somebody that's watching. Hey, Daisy Gonzalez, how's
Yes,
it going? I'm glad you're here watching us. Tune into this show because Sharon is giving us a lot of medical answers to a lot of situations we can be at right now. We've had this is what our fifth show or something like that or something
I
like
think
that.
I've lost count.
Yeah,
I've
yeah.
lost count, but it's been quite a bit.
So definitely follow and share Gold Rush Health Solutions. Definitely friend Sharon Moreno so that you
Yeah,
can be in tune with what's going on with this show and all the stuff she does for the community. Today, if you all read her Facebook, she was offering B12 something having to do with B12. I guess it was a freebie or an
B12
offer or something.
injection.
Yeah.
Sure. Yes, it
And
is a free
so
B12. If you have never seen me for a vitamin B12 injection and you would like to have a free vitamin B12 injection, send me a text message to 956-640-6963 or through my messenger, and I'm happy to meet you and give you the vitamin B12 so that you can so you can feel the benefits of the vitamin B12 at absolutely no cost to all my listeners.
she'll inject you with it, right? You just won't give it
Yes.
to them. Yeah, it's like
No, no, I'll
no,
give them the injection. Yes, when they meet me for the injection, I give it to them.
yeah. So that's cool,
Yes.
man. That's hey. What else do you want, man? You get free information, free B12 shots. Hey, and like Norma said, after one B shot injection, she felt better, or what was it? Her Tia felt better,
It was
and
her mother.
wow. I mean, you have something wrong with you and you take some medicine and you don't feel better the next day.
After one dose.
Yeah,
And that's exactly why I'm doing these free vitamin B12 injections because I am completely convinced that your life will be changed for the better. And so I know that if I give you one B12 injection, you're going to come back to see me to order B12.
yeah,
So
yeah.
I have absolutely no problem giving you a B12 because I know you'll be back.
Hey, you give us a cookie and we go back for the bag.
There you go. There you go.
Oh yeah,
Yep.
yeah. So great, guys, man. It was an awesome show. Thank you for joining us tonight on Let's Talk Health. We hope today's episode helped you look at hair loss not as a defeat, but as a doorway to better health and self-awareness. If you're struggling with hair loss, or know somebody who is, you're not alone. There are answers, there's support, there's hope. And so Sharon's here to give you all that. Stay informed, stay encouraged, and more importantly, guys, take care of your health with from the inside out. Until next time, remember, your hair is part of you, but it doesn't define you. What matters most is what's growing within.
There you go. Alrighty, thank you guys. Good night, and we'll see you next Wednesday.
Have a good one.